The latest news reaching us, of course, Tanzania, Somalia and Liberia being the first countries to confirm their first cases of the COVID-19 or coronavirus. Dr. Mercy Korir now joining us here in studio to just quickly talk about what the numbers look like and what we mentioned earlier. Why is it important for the country to be on lockdown now? So Tanzania has confirmed its first case, Somalia as well, Liberia. Generally, what do the numbers look like in the African continent?
I think in the African continent, we've seen that Africa is sort of like the last continent to be reporting the COVID-19 coronavirus cases. So far, about just over 300 cases in Africa. Luckily, Egypt was the one with the highest numbers at 126.
A big number.
Yeah, a big number. But luckily, they've only reported 2 deaths, and people have been recovering as expected, and as has been seen in the other countries. The other countries that had earlier reported are like South Africa with 51, Algeria 48, Morocco 28, and luckily for the other East African countries, they've had, like Rwanda has had 5, Ethiopia has had 4, Kenya has had 3. So this is an encouraging trend that the numbers in Africa are not increasing. And I think looking at what African countries are doing, the restrictions that are being put in place, this is probably borrowing from what happened in China.
Yeah.
Remember that China and Europe has seen an increase in the number of the cases. And as we had seen, when the number of cases started increasing in Hubei, in Wuhan...
We can see that.
Yeah, we can see that.
On this graph, yes.
Yes. When the numbers started increasing, there was a lockdown in Wuhan, and the other provinces initiated a lockdown. So if you see from this graph that was published at medium.com, this was courtesy of Thomas Pueo, the graphs have sort of remained stable because the other provinces did a lockdown and quarantine soon after there was an announcement of the lockdown in Wuhan. So they were able to contain and limit the spread of the virus. So what happened is that there was a gradual increase in the numbers, and they were able to maintain the numbers at a low level. Now, when you look at South Korea, Italy,
yes.
Iran, there's a spike.
Yes.
Because the lockdown came in too late, when now there had been an increase in the person-to-person transmission because of interaction of people. So that's why you see there is a spike. So this is probably what the Kenyan government has borrowed from these countries and what they've done, where you initiate a lockdown early enough, yes, so that now you do not experience a spike in the numbers, and this spike is what is causing sort of a crash in the health system, because now when many people are affected and they're suffering, then you find that there's a big demand in the health system, because now you need critical care for people when they start experiencing respiratory failure.
So then what, having gotten into a lockdown early as a country, we would expect new cases,
yes,
but
definitely.
The numbers would not be what we're seeing in South Korea, Italy, Iran.
Exactly. With an early lockdown, then we expect that our graph or our line would remain flat. As you saw, some people are saying, maintain the flat line.
Yes.
So that's why people are being asked to stay at home. That's why the schools are being closed. Unnecessary or non-essential travel is being closed. Non-essential employees are being asked to stay home so that we can limit and contain. So that we expect that the numbers will probably increase, but not marginally high, so that we don't see what now we see like in Singapore, in Japan, where there was a spike. And this is what we are trying to avoid, because you cannot avoid the person-to-person transmission of this coronavirus.
So this are the cases outside China, and what we've been able to see so far. Can you just quickly explain what has happened? Because I read somewhere all these countries also experienced MERS, the MERS virus, yes. I should say. So then we are seeing the same graph as we've seen with Iran,
yes,
Italy.
Yes, actually, the best example of a country that was able to have learned from the SARS outbreak earlier on in the 2000s is Taiwan. Taiwan, I think at this time, they've had less than 50 or about 50 confirmed coronavirus cases, because what happened is they initiated a lockdown immediately. They were able to message and communicate to the public in time so that people are aware that there's something happening, maintain hygiene, maintain social distancing and all of these things. So they have been able to maintain their numbers. And remember that Taiwan is close to China. So they could have easily had a spike in the numbers. So they were able to maintain. So the countries that have a flat line, did the restrictions, the lockdowns, the social distancing, and all of those things, they put them in place before they experienced
From
a spike.
lessons learned from SARS.
From lessons, yes. From lessons learned earlier, in the, let's call them from the other outbreaks. And I think one of the other countries coming closer home is Nigeria. Nigeria so far has 3 reported cases like Kenya. Remember when there was the Ebola outbreak in West Africa, Nigeria was one of the first countries to actually contain the situation. I remember their close proximity to the other West African countries, Sierra Leone and whatnot. So it is just picking from those lessons, applying the public health guidelines and protocols as is expected. And so we hope that if our government borrows from this, then we will be able to contain the coronavirus outbreak. We'll not see a surge in the number of cases. And most importantly, we do not expect, or we hope that we do not get a big number of Kenyans who require critical care, because our system as is will not be able to handle a large number of people demanding critical care.
Great. Thank you very much. Always a pleasure to have you here. You've heard it. For Kenya to maintain a flat line, this lockdown is very important, just restricting movement in and out of the country. And of course, workplaces, just ensuring that we minimize personal contact among the citizens. Now, still on the same,